Today we will discuss about obstructive sleep apnea or OSA. OSA is a disease which causes lack of oxygen in the body due to collapse of the upper airway when a person sleeps. Risk factor for OSA can be obesity, short neck, asthma, upper airway issues like deviated nasal septum, alcohol intake, smoking, CVS or cardiovascular disorders, and CNS disorders. Symptoms of OSA include shortness of breath, snoring in the night, excessive daytime sleepiness, irritability, and heavy-headedness or repeated headaches. Diagnosis of obstructive sleep apnea is usually done by a sleep study or polysomnography, and other routine investigations are also used like blood investigations and x-rays of the chest. Treatment of obstructive sleep apnea includes sleep hygiene, CPAP or BiPAP machine, inhaler use if a person is suffering from asthma. Thank you.